Let's go over heart failure in about 3 minutes.
In simple terms, heart failure is when the heart is unable to pump an adequate amount of oxygenated blood to the body. So in short, the pumping mechanism of the heart becomes impaired. This causes blood to back up into the body, and there are two types of heart failure: left-sided heart failure and right-sided heart failure. To make this easy to understand, imagine this is the heart and it's split into 4 chambers. The heart receives nice oxygenated blood into the left atrium. Then the oxygenated blood leaves the left ventricle and it goes to the rest of the body. And then once the body's used the oxygenated blood, it'll come all the way back, deoxygenated to the right atrium, down into the right ventricle, and it'll go back to the lungs to get oxygenated again, and the whole process will start again. In left-sided heart failure, the pumping mechanism will fail to the rest of the body, and you'll start getting blood come all the way back up here, and the lungs will become overloaded with fluid. In a similar way, in right-sided heart failure, this pumping mechanism from the right ventricle will fail, so blood will start back flowing down into the rest of the body. In left-sided heart failure, fluid backs up into the lungs, and this causes pulmonary edema. Symptoms of pulmonary edema are chest crackles, a nagging cough, shortness of breath on exertion, and the patient will struggle to breathe when they're lying down sometimes, and an arrhythmia because the heart's trying to compensate. So imagine left side equals lungs, and that's how you remember left-sided heart failure. In right-sided heart failure, instead of fluid backing up into the lungs, it backs up into the venous system, causing peripheral edema. Symptoms of this are swelling to the limbs, pitting edema, weight gain, and a large jugular vein distension, which in short is your neck vein. And the way to remember this is right-sided heart failure equals the rest of the body. In heart failure, you have a decreased cardiac output, and this means you have a reduced ejection fraction. And in heart failure, it's usually around about below 40%. Ejection fraction is the volume of fluid that is ejected from the chambers of the heart per contraction. Reduced cardiac output activates the renin-angiotensin-aldosterone system in the kidneys, and this means you retain more urine. This also causes vasoconstriction, which can increase the blood pressure. Also, when the cardiac output decreases, you also get a sympathetic nervous system response, which increases the heart rate and causes vasoconstriction, which also causes edema and a high blood pressure. So in heart failure, this system goes around and round and round until the heart failure gets worse, and this ejection fraction gets lower and lower as the years go on.
I hope that helps, and that's just a quick introduction to heart failure and the difference between left-sided and right-sided. When you see a patient in hospital now, you'll have a better understanding of what's going on inside the body.